You might recognize Nick Wilkins, a content creator who's worked with people like Will Smith and Mr. Beast. He's a creative powerhouse in his early 20s, and he noticed some hair thinning and wanted to take control early. When he reached out to me and we decided that we were going to do a hair transplant for him, I was super excited. But what started as a routine hair transplant turned into one of the most unexpected cases of my career. His body broke out into a full body rash minutes after receiving anesthesia. We had to stop everything. Today I'll show you what happened, how we figured it out, and how months later we completed his surgery with over 2,000 grafts for a natural, long-lasting result. Nick is one of those Gen Z creators who does it all: filmmaking, editing, and storytelling. With over 20 million followers across platforms, he's always in front of the camera. He reached out to me on Instagram after having followed me for a while, and Nick was super proactive about his hair. He had already been on finasteride and was microneedling for over a year. His hair was stable and he was able to get some of the smaller hairs back at his hairline, but the hair just wouldn't grow long, so he was looking to reinforce and rebuild his hairline. And because of his age, we had to be careful to stay conservative with his hairline design. Because when someone is in their early 20s, even if the hair is stable on medical therapy, there's always a risk of them losing more hair over time. So we planned a mature, age-appropriate hairline that looked natural now, but preserved plenty of donor supply for the future. The morning of his first surgery looked like any other, except for the entire film crew that he brought. And Nick took the standard pre-op medications, including a mild sedative, vitamin K, a steroid, and an oral antibiotic. Once the markings were done and the shaving was complete, we then started with a small donor site test using 1% lidocaine with epinephrine. This is something that I use for every single hair transplant patient. But within minutes, something unusual started to happen. At 8:43 a.m., Nick mentioned mild itching on his legs. By 8:45 a.m., it spread to his neck. And by 8:53 a.m., he was red from head to toe. There were no breathing issues and his vital signs remained normal, but we stopped the procedure immediately. We gave him diphenhydramine and monitored him closely, and we quickly decided to send him to an urgent care nearby in order to make sure that we weren't missing anything. At the urgent care, they gave him a dose of IV steroid and diphenhydramine with resolution of symptoms within a few hours. And when we talked to him later that day, he told us that the itching actually started before the injection of anesthesia. He said he actually felt it soon after taking the oral antibiotic. That clue turned out to be important. This was not a case of anaphylaxis because his airway was fine and his vitals stayed normal the entire time, but it was a clear allergic skin reaction, and a fairly severe one at that. I've done thousands of surgeries under local anesthesia, but I've never seen a reaction quite like this.
So a few weeks ago, I went to New York City for a hair transplant because, I was suffering with hair loss. I learned how to get it back, but I wanted to get a transplant to seal the deal. But just as we were beginning the surgery for my transplant, I suddenly had an allergic reaction to the medicine I was given before the surgery. I didn't know I was going to be allergic to anything before this, so it was no one's fault, but it did cause me to look like a supervillain. I'm having like an allergic reaction right now. I look like a supervillain. I'm about to hit the New York streets. But yeah, I didn't get the transplant yet. I'll have to go back soon and take different medicine before. And in the meantime, I shaved my head because my hair was already cooked.
Ready to see it? Turn around.
And moments like this remind us that safety always comes first. We knew this was going to be a major inconvenience to have to bring Nick back for another attempt at surgery, but it was the right thing to do. Had we continued with that procedure, it's possible that he would have had a worrisome outcome. And who knows, maybe this was meant to be, because the first time when I designed Nick's hairline, I did not include the temples because it wasn't something he was too keen on and it wasn't something he came in wanting. But the second time around, when we really thought about the artistic design of his hairline, we did end up bringing the temples in and recreating some of that form and shape, and that overall I think gave him an even more youthful type of result. So who knows, maybe this was meant to be. Our next step was to send Nick for allergy testing. His allergist tested him for lidocaine, bupivacaine, and Kenalog all came back negative. And that left one likely culprit, the oral antibiotic that he was given for surgery, cefadroxil, which is in the cephalosporin family. It's rare, but sometimes these reactions happen even with common medications. In medicine, you don't always get the perfect answers, but you have to learn to adapt to every situation. 2 months later, Nick was ready to try again. All right, Nick, welcome back.
Happy to be back. Excited.
How do you feel?
Feel good.
Okay.
Feel confident. I do actually. I feel confident about this. Yeah.
Give you an extra bottle of shampoo later.
Yeah, let's go.
And this time around, we changed a few things. We avoided betadine and chlorhexidine, which we usually use to clean the skin. We opted for alcohol only. We also avoided Kenalog. Even though Nick was tested for that, we decided that it wasn't absolutely necessary for his surgery, so we just removed that variable. We also avoided local anesthesia with preservative. Remember that most local anesthetics come with a preservative. That's what allows you to continue to go back into those vials and to use them over a series of procedures. They're called multi-dose vials because they have a preservative. So instead, we had to buy a less common form of it, which is a single dose vial, and this time it did not have preservative because some people rarely are allergic to the preservative, and we knew that he was not tested for those preservatives. And of course, we switched his antibiotic, this time to doxycycline. And luckily, everything went perfectly this time. We transplanted 2,150 grafts, of which 740 grafts were single hair grafts because we worked into the temples, and the temples only received single hair grafts, as well as the first few rows of his hairline were all in single hair grafts. And that created a soft, natural hairline. And the multi-hair grafts were used behind those first few rows to help build up density. The goal was a subtle improvement that would leave him camera ready, but would not make it so obvious and would not detract from his overall appearance. And it was a hairline that didn't deviate much from what he once had. The recovery this time was smooth from start to finish. There was minimal swelling, normal shedding, and steady regrowth over months ahead. And Nick documented every step, so take a look.
So this is day 4 after my surgery. So far, just a little swelling, but no real pain. It's not really itchy here. It does hurt a tiny bit to sleep on my head like that, but overall, everything's looking good. I'm excited. All right, so this is 2 weeks out from my surgery. I got all the scabs off. As you can tell, I can finally kind of touch it. I can finally start wearing hats tomorrow. Yeah, it's looking up. This is all the hair. It's slowly coming in. So far, no pain, nothing anymore. Actually, like nothing. I finally get to work out tomorrow. Yeah, the swelling has all gone. I can sleep normally. It's awesome. Still excited to see what it really looks like when it gets a little thicker in a few months. All right, so it's been 3 weeks since the surgery. Right now, this is what it's looking like. Experiencing possible a little bit of shedding. It's still tiny bit red and a little tender to the touch. But other than that, nothing crazy new. That's what we're looking like.
And during his recovery, he focused on scalp care, keeping things clean, hydrated, and nourished. And he actually used our Feel Confident line of hair care products throughout the process, including our doctor-formulated shampoo, conditioner, and thickening foam to help maintain a healthy scalp environment while his hair grew in. And by the 1-year mark, the transformation was complete. Full, natural, and perfectly matched to his face. And it was exactly what we had envisioned, a conservative, lifelong design with sustainable donor management.
It's good to be back. I'm excited to be here again. Almost a year.
1 year.
Yeah.
1 year.
Yeah.
Did it go as you kind of thought it would?
Yeah, I got everything out of it that I wanted to. I was able to focus on work again and just be kind of like confident again after the procedure, not think about hair. So definitely I got what I wanted out of it, yeah.
That's awesome. Yeah, some people say like they wear wear hats a lot, you know, and then you get the procedure to the hairline, and then like all of a sudden hats come off.
I do like wearing the hat. I think the hair under the hat look I like to wear, but honestly, I do just not wear hats as much as I used to.
Yeah, a lot of people think that it's like you get one of these procedures to like show it off, but it's really, it's like you don't have to think about it as much, right?
Yeah.
Like that's really what it ends up being. Because it's different from other plastic surgeries where people want to like show off the outcome.
Yeah.
For hair, it's like you want it to look natural and normal. If you want to tell people about it, you can, but it's like a different type of objective sometimes.
Yeah, I definitely try to share with people as much as I can because it's just not like a talked about thing. If you just show them like, yeah, this was a transplant, it's like, oh, it looks so natural. That's why I always kind of like to tell people. I think more people should be kind of talking about it more instead of avoiding it because it's such like a easy process now because it's been so many years since it started. Yeah, I definitely like to share with people when I can.
We appreciate you being so public.
Oh yeah.
Yeah, I'm very happy for you. Thanks so much for us.
Yeah, thank you for everything you've done for me too. You've helped like way more ways than you probably think. So yeah, I'm very happy with everything. So yeah, thank you again.
Of course, man.
Yeah,
We did it.
Heck yeah, man. Let's go.
Awesome. And you can see why I talk about hair transplant surgery as an art form, because of course there's a lot of technique involved, but we always want to make sure that the results look pleasing to the eye and that it doesn't read as a hair transplant. It's fine when people are willing to share their stories and tell people that they had a procedure done, but it's not something that you necessarily want someone to notice from the minute they meet you. So to do the work right, it takes an artistic eye, because everyone has a different shape to their head, everyone has a different starting hairline and different goals, right? So it's about using that and working with it to get people to the best possible result every single time. And this case was a reminder that aesthetic surgery is not just about technique. It's about safety, patience, and proper long-term thinking. Even after years of doing this, a case like Nick's reminds me that surgery is part science and part humanity. And it's not just about restoring hair. It's about restoring confidence. And a huge thank you to Nick for allowing us to share his journey. If you found this story interesting, please make sure to subscribe to the channel and let me know in the comments below if you've ever had an unexpected reaction to a medication or to a surgical procedure.